Hello everyone, my name is Robyn McIntyre and I am the Clinical Nurse Educator in Oncology at Ballarat Health Services, and today I'm going to be showing you how to access a port. So we have set up our mannequin here on the trolley. However, prior to actually coming to the patient bedside, I would actually clean my trolley and assemble my equipment and then bring all my equipment to the patient bedside. So our equipment is as follows. It's a sterile procedure, so we certainly need our dressing tray, our basic dressing tray, gloves to size, non-sterile gloves. We use the 2% chlorhexidine and 70% isopropyl alcohol swabs to clean. We use 3 10mm Luolock syringes, and they must be 10mm in Luolock. We also have our drawing up syringes. We use our saline, normal saline for flushing. If I needed to actually put a dressing over the top, we use an IV3000. And we use the specialist needles, the non-coring needles, to access ports. And in this health service, we use the Shorcan safety needle, manufactured by Braun. To create a closed system, we also use the neutron valve. So at this stage, I would bring this to the patient bedside, of course introduce myself and let the patient know why I'm here and obtain their consent. And of course we use our 3 patient identifiers. So at this stage I would actually look to give my hands a clean. Now ports can be either in the patient's chest, either side, or in the patient's upper arm. It just depends where they've been actually initially inserted. Most of the time Ballarat Health Service ports will be arm ports. It doesn't change what we do. So at this stage I'm going to assess the area of the port and locate the ports for accessing. So it's preferable to put on your non-sterile gloves at this stage to do this. You need to, so most patients will actually have a scar above their port area, and they'll certainly be able to show you where the actual port is. So now it's just a matter of actually locating the housing of the port, the outside part of the port, and being able to assess the centre of the port, and that's where you'll access the actual silicone in the port itself. So once you're happy where you're going to access, you then can take your hands away, and at this stage we would actually clean the site, the primary site. Carefully open up your swab. Now I have a plain swab here. Some of the swabs will be tinted pink, that's okay, they're both the same thing. And now we actually apply this in a crisscross motion across the port area. And we must do this for a minute. It's really important to create a bactericidal environment, and we do this by actually gentle friction using the alcohol and the chlorhexidine. This creates a chemical reaction with the protein in the skin called denaturation of proteins. So it's just back and forth and then up and down. You can use a secondary swab if you wish. But make sure you actually cover the whole area and where you're actually going to put the dressing as well. So once your minute is up, the second part of this process is to allow it to air dry. And during this time, then you can actually set up your tray. Just take that all off now. I'll use a secondary area, clean area, to put my gloves, and this has been pre-cleaned as well. And now it's just a matter of setting up all my tray equipment. Neutron goes on. Non-coring needle and my syringes. Now we are moving towards pre-filled normal saline syringes. So decantering your syringes will be much easier because you'll just be decantering the syringes with the saline in. We won't need to actually draw up our saline that I'm going to do in this part of the procedure. And now I'm just ready to actually do my standard hand wash and put on my sterile gloves. So again, you do this for 20 seconds and allow your hands to dry. It could be either soap and water or it can be the alcohol gel. And now it's just a matter of preparing all our equipment. Our end of our safety needle, we put our free-flowing connector on. Just take off both the ends and connect to create a closed system. And now we just draw up our saline. Of course, as I mentioned before, once we have the pre-filled syringes, you won't need to do this process. It'll be straightforward. Now I'll just use one of these syringes that hasn't been completely filled up with 10 ml of saline, just to prime the line. As so. And now I am ready to access the port area. So just drape your sterile drape just underneath. So if it's an arm port, you'll actually just drape it over the arm underneath the port area. On the chest, it's just on the lower part of the abdomen. Be sure to tell the patients not to actually touch. That's really important. Now it's just a matter of actually bringing over your equipment, and here it's close enough. To access the port, we need to actually bring back the clear butterfly of the actual needle, take off the sheath. So to access the port, I just make sure that I relocate the outer housing of the port. I have done my assessment earlier, so the less I touch now, the better. It means less contamination. You can just locate the septum if required, but once you're happy to actually access the port, you bring the needle in a 90-degree angle to the port and in the middle and completely go in. Now, the needle will actually terminate at the bottom of the port, so once you've hit the bottom, you know that you're in. So now you can actually let go, because the silicone in the port will hold the actual needle, and at this stage you can actually just check the patency. And once you've seen patency there, you know that you're in, so just take off the first 5 ml of blood, because we don't want to push any contaminant into the patient where we can. Once you've cleared the catheter, now you can flush. And our flushing motion is a quick stop-start motion. So it's called a pulsatile flush. So nice and quick. Protect your key parts. And just at 0.5 ml, just clamp before you actually release the syringe. So just grab your IV 3000 and just drape it over the top, don't pull it too tight, and create that extra support and seal.